Older adult, the late adulthood or the old age, is generally considered to begin at the age of 65. Old age is considered to be the last stage of life. At this stage, we are already advanced in age and some of our capabilities diminish. Full psychological maturity is also consolidated. Before going to the details, please remember to subscribe the channel. Thank you. Theories of successful aging. The disengagement theory. It states that as the people age, there will be withdrawal from the society. It is normal and desirable because it relieves them of responsibilities and roles that have become difficult. So, as the people age, they tend to withdraw from the society so that they will be relieved from the roles and responsibilities. And this process, it open up opportunities for younger people and the society will get benefited with more energetic young people who fill the vacated positions. Next is the activity theory. It says that activity is necessary to maintain a life of quality. No matter what one's age is, people who remain active in all respects like physically, mentally and socially, they adjust better to the aging process. So it is always important to be active to get better adjusted to the aging. The activities of the earlier years, it should be maintained as long as possible. Ageism. It is defined as a prejudice or it can be discrimination that occurs on the basis of age. Although it can be used against people of all ages, the older people are more frequently its target. And it may often result in forced retirement. Usually people say, she is old or he is old, so he won't be able to do that much, this much. That kind of prejudice people will have and they discriminate because they are getting old or they are more slower, so their output will be less. So that kind of discrimination can be shown to the older people and it can result in a forced retirement. The stereotyping of the elderly is also an aspect of the ageism. Physical changes. The cells in the human body, it become age. As the cells age, they function less well. Then what happens? The old cells will die and it is a part of the body's normal functioning. That is, the aging of cells is a normal thing. Then the organs will age. The first sign of aging involve the musculoskeletal system. Then most of the internal functions also decline with aging. The walls of the heart become thicker, the arteries are stiffer, and the heart rate slows as people age. Then the blood vessels, it tend to become less elastic with the age, and these stiffness may contribute to high blood pressure. Then the bones and joints. The bones tend to become less dense. In women, loss of bone density speed up after the menopause because there will be less estrogen is produced. The amount of calcium decrease because the body absorbs less calcium from the foods. Also, the levels of vitamin D, it will also become less. The ligaments which binds the joints together, the tendons which binds the muscle to the bone, They all become less elastic and the joints will feel tight or stiff. The tissue will also become weakened. Then the muscle and body fat. The amount of the muscle mass and the muscle strength, it tend to decrease after the age of 30 and it continue throughout the life. Some of the decrease is caused by physical inactivity and the decreasing level of growth hormone. By the age of 75, the percentage of the body fat, it typically doubles compared with what it was during the young adulthood. Then eyes. A change in vision is often the first undeniable sign of aging and it starts appearing by the age of 40. Then ears. As the people aged, hearing high-pitched sound, it become more difficult and this change is considered age-associated hearing loss. Then the mouth and nose. As the people age, the taste buds on the tongue decrease in sensitivity. The ability to smell diminish because the lining of the nose become thinner and drier and the nerve endings in the nose it deteriorate. Then the skin, it tend to become thinner, less elastic and drier and there will be fine wrinkles. The aging body produces less collagen and elastic. That is why the skin becomes thinner and the wrinkle starts appear. When the fat layer become thin beneath the skin, then the wrinkle become more likely to develop and the tolerance for the cold also decrease when this fat layer become thin. So these are certain physical changes that appear in old age people. The cognitive changes. Generally, the information processing slows as the people grow older. The older people have more trouble in multitasking. They can do only one thing at a time or maybe two. But more than that, they cannot focus their attention. The response speed, that is found to be decline. Then the age-related decrease in the memory. If the memory decrease, then what happens is like there will be poor performance in the cognitive task. Then the fluid intelligence, that is appeared to be decline in the older year that we have seen in the middle adulthood. From that time, the fluid intelligence it start decline and the crystallized intelligence, it seems to show a rise slightly over the entire lifespan. And studies have shown that this decline in the cognitive performance could be reversed 40 to 60% if they are given remedial training. Then dementia. Dementias are responsible for cognitive defect. This disorder occur in about 15% of the people over the age of 65. The leading cause of dementia in many countries is Alzheimer's disease. It is a progressive, eventually fatal disease that begins with confusion and memory lapses and ends with the loss of ability to care for oneself. So, in certain cases, the Alzheimer's disease is the cause of dementia. And other than dementia, there will be mild memory loss also seen in old age people. Social changes. Retirement. Retirement is a conventional choice for many people. Some people work much later, But the people have been found to be happier if they are not forced to retire before they are ready, and if they have adequate income to have a healthy life, then they will be happy. Otherwise, if somebody was forced to retire and they don't have adequate income, then they won't be happier. So the retirement, the process or that stage depends on whether they are adjusted to the retirement process or whether they were forced to retire. Then chronic health problems such as arthritis, rheumatism and hypertension, all those things interfere with the quality of the life of the old age people. Then widowhood. Women tend to marry men older than they are, and on an average, the women live 5 to 7 years longer than men. Widowhood is particularly stressful if the death of the spouse occurs early in life. Then the close support of the friends, it can be very helpful during the widowhood. Then there will be greater risk of social isolation. It can happen because of two things. Firstly, the friendship are reduced as the friends may die. Then secondly, the lack of autonomy. That is, when the people become aged, they will be physically weak and they become dependent on others. So they cannot leave the home to meet friends or to have social activities. So social isolation can happen. Emotional changes during the old age. Death and dying. The terminally ill patients, those who are bedridden or those who are having such a serious disease or much weak, they display following basic reactions. First one is denial. They attempt to deny the reality and to isolate oneself from the event is frequently the first reaction. So they deny the reality. Then anger. They become angry very frequently. They think like, why should I be the one to die? Then bargaining may occur. The person plead to the god or others for more time, that they need to live for a longer period. So they bargain. Then as the end near, the recognition that the death is inevitable and that the separation from the family will occur. It can lead to a feeling of exhaustion, futility and deep depression. So they, in the next phase, they recognize that death is inevitable and they will be separated from the family. Then acceptance. The person finds peace with the inevitable. Then emotional problems includes mental health issues. It can be depression due to the loneliness and other factors. Also can arise during the old age period. Now let's see what is gerontology. It is the study of the aging process, including the physical, mental and social changes. The information that the researchers got from the study, it is used to develop strategies and programs for improving the lives of older people. Geriatrics, it is a branch of medicine that specializes in the care of older people. You have seen multi-speciality thing in hospital. So geriatrics is the branch or the wing of medicine that is specialized in the care of older people. It involves managing many disorders and problems at the same time. Now let's have a quick recap on what we have learned about the old age. We have learned the theories of successful aging, then certain changes like physical, cognitive, social and emotional changes that happens during the old age, and the gerontology and the geriatrics. So aging is a gradual process and it occurs naturally and dynamically, and that thing or the process of aging, we cannot avoid it. Some people experience a better quality of life in old age. It depends on the factor like social support, the personality, personal resources, social resources, and the presence or the absence of the psychological disorder. So this is all about the old age in the developmental stage. So it is the last stage of human life, old age. Hope you like this video. Please share and subscribe. Thank you and keep smiling.